looking at the hip. And
Ooh.
hold on.
Ooh.
All the way down.
Oof. Whoa.
Chiro cracks. Chiropractics for everyone.
Definitely neck pain, some lower back pain, but mostly I feel tension in my neck.
Start with that. How long back can you remember having neck pain for?
When I started as an esthetician, so about 3 years ago, I am constantly hunched over, necks, looking over the client, and it just causes a lot of stress in the neck area.
So how often do you say that you have the neck pain? Is it every time you work?
Pretty much every time I work. And then it's kind of stays there for a day or so as well. If I have off, it's kind of there the next day too. So.
All right, do you ever have any pain that goes down your arms?
No, but it does tend to go, because I'm a righty and I'm constantly like mixing up my wax pot, it tends to go to the shoulders as well.
Do you get any headaches ever?
Probably once a month.
How often do you have the low back pain?
That's not as frequent, but recently I did have it really bad, like 3 days ago.
How about jaw?
I do have TMJ.
Okay, looking at the feet first, looks symmetrical. Heel strike, mid stance and toe off on the right or normal. On the left, I do see a little bit of, right during mid stance, there's a little bit of a wobble. I couldn't even tell. It looked like a supination at first, but right at the end, on the instep, right before toe off on the left, there's pronation. So we'll look at the Achilles tendon. The Achilles tendon does look slightly, we do have a slight genu right side. Okay, looking at the shoulder height, looks like we have a high left shoulder, high left shoulder confirmed, and then we have a left lateral flexion of the head tilt, so a high right mastoid process. Looking at the hip height, hard to tell from here, but possibly a higher right hip is where I would say from now. Okay, just observing the spine, we're going to look at the height of the scapula. It is higher on the left. And then looking at the height of the hips, still higher on the right, high right hip, high left shoulder. We'll dig in a little bit deeper and see if there's anything revealing itself. This is a temperature evaluation. Is the back of the fingers. They're more sensitive to temperature. Very consistent, very smooth. There's definitely more warmth from about the lumbar up. This is all very consistent here, and then it cools off, and this is very temperate here over top of the sacrum. And it's consistent from left to right too, so nothing crazy going on here. We're going to dig a little bit deeper into the spine now. Much more fluid and bouncy down in the lumbar spine. There's the most amount of tension right here. And this is very symmetrical. There's no excessive dampness or dryness in your spine too. Your skin is very symmetrical. Good, very even and consistent. Just a little bit of this postural thing that you were talking about right here with that leaning forward. You don't have a hump here or anything, but it's going to be important for you to maintain awareness of that posture so that you don't get one here. All right, so you're going to feel that my fingertips on the back of your hamstrings. We're going to slide up to the glute fold here. Yours is lower on the left, which doesn't match that high right hip here. But lower glute fold on the left, slightly looking from the top. We're externally rotated on the right slightly. So the right one has gone forward and out, and the left one has gone back and in. So it's just like this little rotation here at the top. Okay, no curvatures here. There is a slight deviation. We've got one segment right in the mid-thoracic spine. Go ahead and stand up. Let me see what segment this is. The rhomboid segment. Go ahead and go back forward. Anterior segment right here. Just looking for postural sway here. Tiny movements in posture. There's a lean to the left. Good forward rocking there. Again, forward. Tiny bit to the right, but mostly just forward and backwards. A-to-P sway. Okay, that's good. You can open your eyes. That's good. That means you have stability in your pelvis. Let your shoulders relax here. Good. Tender. Here's that T7. So this is definitely, we have to address this T7 right here. A couple of things here in this transition. Everything wants to move out this way. It's what it feels like. So to center you, we're just going to have to align it in this direction. Any tenderness here?
No, not really.
Tenderness here?
Yep.
Upper left SI, lower SI. Tenderness here?
Oh, a little bit, yeah.
Lower right, and here?
Kind of, yeah.
Good, left hip up like this. Good down. More tender on the left or right here?
Left a little. Ooh.
One more time, let the shoulders relax a little bit. There you go.
Ooh.
Good. Elbows in, and then slouch down, slouch forward. Oh, yeah. Have you ever had this one before?
I don't think so, no.
Scooch forward here to the end. We're going to pull this shoulder out like this, just a little bit like that. Bring your head forward just a little bit. Right there. Good. Shoulder relaxing, coming up. Good. Bringing the hip just a little bit more. Good.
That felt amazing.
Okay. Good. Nice and gentle breathing.
Ooh.
And your back.
That's nice.
Turn your head to the right. Back to center. Bring your right ear down to your shoulder. Back to center. Left ear down to your shoulder. Good, back to center. Bilateral upper cervical, so we may have an anterior left. I'm gonna do the left side first. And then just try to like let your head just completely relax into the table like that. Good. Just like the other adjustments, I'm following your breath. As you breathe out, we're gonna go like this. And a little push in that direction like that, okay? Okay, nice, gentle breathing, good.
Oof. Whoa.
Now, let's see what this right side says, because this is where all that tension is. First, I'm going to test this right side first and see where it needs to be adjusted. So let your head completely relax and let your head drop in. Go testing. 7, 6, 7, 1, 2, spasm on 2. So where do you feel it more? Here or here?
The second one.
Down low, huh? Nice and gentle. We're going to test a little bit more. Just want to see. Okay, letting your head completely relax into the table here. Let it go. Let it drop. Good.
Whoa. Still tingling right now.
In your neck.
That was nice.
Okay, now squeeze as hard as you can. I think it went a little bit. Right?
Yeah, it did.
First start with the ileocecal valve. This is the window between the large and the small intestine. So we're going to locate it by first finding the belly button. Yours is here. Your ASIS, your hip bone, yours is here. We connect these 2 points like that. That's where we begin looking for the ileocecal valve. Good, yours is very calm right now. It might be a little bit tender. Good, we're going to do the pyloric sphincter now. This is the window between the stomach and the small intestine. Did you eat today?
Did I eat today? Yeah, I ate today.
What did you eat today?
I had pasta 4 hours ago. Yeah. I did.
Okay, cool.
I did.
All right, so this is a diaphragm manipulation now. So we're just going to come around the diaphragm. Do you know how to belly breathe? So push your belly out. Good. Now pull your belly back in. Good. Push your belly out again. Pull it back in. Good. One more deep belly breath. There you go. Might be a little bit more. Just do a couple more belly breaths. Quiet belly breathing. Okay, let's see. Open. Damn. Close. Open your jaw halfway. Now push your jaw to the right against my hand. Good. Push, push, push. Good. Left. Open. Push to the left. Good. Okay, bring your arms to your belly. Okay, just like the other adjustments, we're following your breath. Okay, I'm going to use the towel to support your neck. You okay with that?
Yep.
Good, and out.
gosh. Wow.
Feel it all the way down?
Oh, yeah. I'm still feeling it.
Yep.
Wow.
It dissipates.
Oh,
Yeah, just hang in there. It goes away.
I definitely needed that though.
Yeah.
For sure.
There was definitely some uncrinkling in your neck.
I'm still feeling it.
Where do you feel it the most right now?
My right.
Okay, good. Exactly where you need to feel it.
That was awesome.
Yep.
I was trying not to say like a curse word. I was like, let me contain my words for a second. That was nice though.
All right. Let's see. Go ahead and stand up. Walk around a little bit. Let's see how it feels.
Feels lighter.
Nice.
I feel free.
Those are good things.
Yeah. Definitely not as much tension.
Shoulders are even. And your head is even too. Put your hands on top of your hips. Yep, still a little bit higher on the right hip, but that's okay. The hips are harder to resolve. Go drop your arms again. Yeah, but your right and left shoulder. Even Steven.
I still feel it a little.
Here, let this relax. This is the rest, huh? Does it hurt? Want to do that?
Some tension for sure.
You're guarding it. You're definitely protecting.
I know.
Try to let it go. We're gonna just work out the tension like this for a minute.
I carry most of my tension in my neck and shoulders.
Have you ever had any major accidents or injuries with your neck?
Mm-hmm.
How far back can you remember having neck tension and shoulder tension?
Probably like 17, 18.
Years old?
Mm-hmm.
So you're still in high school. Did you play sports?
Volleyball, basketball.
You played sports, but no injuries while you were playing sports.
Mm.
Well, what kind of stress is it? When do you feel it?
It's typically when I feel overwhelmed or if I know like I got a lot going on. If I'm stressed, I can just feel it in my shoulder blades.
What do you do to alleviate it?
I do these in the morning. Sometimes I'll do like a neck roll. I'll stretch if I really feel like my body's out of alignment.
The source of this is mental stress. How do you address it on that level?
I was previously a flight attendant. It's like 12, 14-hour days where you can't actually take time to yourself.
Do you ever get any headaches?
After I drink wine.
When's the last time you were adjusted?
Years.
Looking at the feet first. No supination, no pronation, no inversion or eversion. I don't see any bowing of the Achilles tendon quite so much. From the knee down, I don't see any genu varum, no genu valgus. Probably a left high hip and a left high shoulder, and then a high left ear, all leaning to that one side. That happens with hypermobility sometimes. Can you crack your own back?
Yes.
Actually, it's the right hip that's higher. No bowing of the Achilles tendons. That's straight up and down. That's good. I'm going to do a very gentle scan on the top of your spine. All the increased tone is here on this left side. Let's do a temperature exam and see how that feels. Using the back of the hands, which are more sensitive to temperature. This is calm and cool and consistent, symmetrical all throughout. And then as soon as we get to right here, the heat starts increasing. It's about even left to right. I'm going to push a little bit deeper into the spine. All of this tension right here is actually all coming from up here in the cervical spine. Both rhomboid muscles are hypertonic. Very little movement in C6. Sliding up to the glute folds here. Bottom of the glute folds, pretty close to even actually. And then looking from the top here, a little bit more accentuated on the left. So this left one might be externally rotated, and then the right one is fired up here. High right standing, high left seated. It's pretty interesting actually. Touch your toes. No curvatures here. Close your eyes. Looking for swaying motions. So far we've had some right left stuff. Back to that right side again. Can you touch your thumb to here? Any tenderness here?
Un poquito.
Aquí?
A little more so on this side.
Let your shoulders sink in. Nice, gentle breathing in through your nose. This one should be better down here. Still tender?
Not as much.
Does that feel a little better?
Mm-hmm.
Nice, gentle breathing. One more stretch. Deep breath in. Shoulders. Good. That was the release right there. You just let it go. That's it right there. You're just going to feel your body sink. That's the too easy. It happens all the time by itself, just from stretching. We need to get deeper. Deep breath in. Shoulders relaxing, sinking in.
That was good.
Gentle, gentle, gentle. You're doing good. Let the shoulders sink in. Let the neck relax. Good.
Exactly what was needed to be done.
Any tenderness here?
Yes.
Here.
No.
Left leg is short and stage short, which points to the right SI joint. Tenderness here.
Yes.
I'm going to move you forward here just a little bit. Let your head relax. Top leg is bent, bottom leg is straight. We're just going to bring it up and in like that. Nice and gentle. That's really good. And bend the top leg like this. And scoot you forward here like this a little bit. I'm going to push your shoulders in this direction. Then we push down in that way. Shoulders coming up. That's perfect. Nice and gentle. I'm going to bring your head over to the side like this. Let your head and shoulders relax.
Oh. Wow.
Let it go.
Oh my god. That's crazy. I don't feel like crunchy anymore.
Relax this foot. Let it go. Digestive organ manipulation, okay? It starts with the ileocecal valve. This is the window between the large and the small intestine. You're located by first finding the belly button. Yours is here. And your ASIS, the front of your hip bone. Connect these 2 points. In the middle is where we start looking for the ileocecal valve. Yours is a little tender. Next one is the pyloric sphincter, 2 inches above the belly button. Can you breathe into your belly? Very good. And out. Take a deep breath in, and then as you breathe out, I want you to lean back. Breathe, breathe, breathe.
Very nice.
Is that okay if I do that? All you have to do is keep your teeth together. I'm going to follow your breath, and as you breathe out, we're going to go in this direction. Try to let your neck and shoulders relax. This one's a little more aggressive than the other ones. Deep breath in and out. Breathe. You felt it all the way down.
Mm-hmm. That was crazy because I felt separated here and here. That was good.
Right side push. Much better up here, huh?
Mm-hmm. That's insane.
me about the low back pain.
I think it's just my posture mostly throughout the day, and I'm not stretching enough.
Does it hurt you at work?
Yeah, I'm mostly bent over most of the day.
You know these things. Okay, that's most important, that you know about your posture and that you know about stretching. How far back can you remember the back pain?
Probably just a couple of years.
How long have you been a dental hygienist?
About 6 years.
When it hurts, does it hurt one side more than the other?
Pretty consistent.
In the middle?
Yeah.
Does it go down your legs ever?
I feel like I had some maybe sciatica, something going on the left side.
Do you have any neck pain, shoulder
I
pain?
used to be a swimmer. I injured that when I was 18, never went to physical therapy. And then also with dentistry, I feel like I just have less of a range of motion, especially to the left side. It starts to kind of get tougher over there.
You have headaches ever?
Sometimes, but not often.
Once a month? Less?
Yeah.
I don't see any external or internal inversion, eversion on the foot. I don't see any pronates or supination from the knee down. Look straight, no varus or valgus deformities. Looking at the shoulder height, possibly left, but definitely a right head tilt there. Hip swing looks symmetrical, possibly restricted on the left. Let's do this. I'm going to do a very gentle scan on the top of your spine. A little bit of right lumbar stuff coming up here. I'm going to do a temperature evaluation with the back of my hands, which are more sensitive to temperature. Very consistent. Slightly warmer here in between the shoulder blades. I'm going to dig a little bit deeper into the muscles. Most of the tension I'm feeling here is in the right lumbar and then this upper left.
I had a pinched nerve in that left side a decade ago.
Your skin does not like to be touched.
Mm-mm.
Sorry.
No, it's okay.
Very flexible in the scapula area here. You have a little bit of trap tenderness here. Is that tender here?
Yeah.
And it was turning to the left that we had the restriction.
Uh-huh. Somewhere over here.
I'm going to palpate the SI joints. Which is more tender, right or left?
Right.
Here. Here.
There.
Left or right, which is more tender here?
Left.
Tracing up to the bottom of the glute fold, we're definitely lower on the right side here, which means the right hip is going back like this. Then looking from the top, it's either back and out or forward and in. Go ahead and close your eyes. Looking for small deviations in posture. Right, left, right. I don't see a whole lot of forward back. Definitely more to the left or right. Can you crack your own back?
Yeah.
Do you crack it a lot?
Mm-mm.
Tender?
Mm-hmm.
Tender.
Mm-hmm.
T2, C5, both left. What about this one here?
Yeah, a little sore.
Right, left,
Right.
left, right.
Right.
Glute fibers, left or right?
Left.
I'm getting a lot of muscle stuff out here.
Okay.
So hopefully not sciatica, pinched nerve, disc issue. Okay, much harder to fix. Left short, stay short. You got yourself a nice little equation down here. It's not straightforward. It is mechanical though. Down, left leg, down. Which side was easier?
Pretty close.
Same thing with the right leg up, down. Left leg, down. Right lumbar fires appropriately. That's good. Because I use 3 different systems at once. And all 3 of them are saying different things right now. It only happens when there's something complex. When we were going this way,
Yeah.
you feel it in your butt cheek.
I feel kind of right here. Only on this side.
We're going to adjust this lumbar from the right. It hurts, and these muscles are compensating, trying to stabilize it. I'm going to push down into your hip. Do you still have that same discomfort tension that you had before?
No.
Nice, gentle breathing. give it a try. Nice and gentle breathing in through your nose. Let the shoulders relax and sink. Shoulders. Nice and gentle breathing in and out. Sinking in. Good. How'd that feel?
Good. Didn't hurt.
Nice and gentle.
There we go.
Turn your head to the right. Back to center. Now left. Back to center. Bring your right ear down to your shoulder. Now center. Bring your left ear down to your shoulder. We're going to bring the head over to like right about here and then push like that. Nice and gentle breathing in through your nose. Shoulders sinking in.
That's my favorite one.
Breathing. Good, and out. Let it all go. Good.
That was good too. Nice.
I'm going to pull on your ankle now in this direction like this. One more. ASIS here. We connect these 2 points. It's where we start looking for the ileocecal valve. Yours is just a bit lower. Tender in here.
Mm-hmm.
Breathing. Is this tender?
Mm-hmm.
This is a diaphragm maneuver, so go and take a deep breath in through your nose. Good, and out. I'm going to use the towel to support your neck like this. You okay with that?
Mm-hmm.
As you're breathing, I'm going to follow your breath outwards, and then as you get to the end of the breath, and I'm going to pull like that. Let's give it a try. Deep breath in and out.
Oh, that was crazy. Oh my God. Usually would stop me here, but that's crazy. Feels better. I feel more relief in like the middle back.
Deep breath in. Keep coming down.
Oh. Oh. Now the hip doesn't feel so tight down there.
Push here. Harder. Gentle.
I didn't know that could pop.
Give me an update on physical reality. Neck pain, shoulders, back.
More lower back recently.
Tell me about it. Did you injure it?
No, I might have slept weird.
How long has it been like this?
Probably last couple days.
How did you feel after I adjusted you last time?
Great.
How long did it last?
There was like a euphoric feeling, honestly. That was probably like a day or two. I just felt lighter.
We worked on like upper back, neck, shoulder stuff last time, right?
Mm.
That's been good?
Yeah.
Good. So we just have to deal with some new lower back stuff?
Mm-hmm.
That's wonderful. Anything else? Any ankles, wrists, knees, elbows?
I'll get fluctuating in between my shoulder blades, like a little achy there if I'm stressed. But that goes in and out.
Any other injuries, hospitalizations?
Correlating to my body now.
Which one feels more tender here? Is it right side, left side?
Right.
Turn to the left. What's the difference between this here and this one over here? Does one side feel more restricted?
This side, I felt like I wasn't able to turn fully.
A little bit restricted going right rotation. It's a little trigger point right there.
Yeah.
There's a little bit of L5 sacrum stuff happening. So I got some rib stuff to deal with too. I'm going to contact this rib right here with my thumb like this. Let that arm relax, let this arm relax here. Lean back against me, like lean your head back there. Hold on, it's right there. Oh, still there. Still tender, right?
Mm-hmm.
We didn't quite got it. Lean back. It's better, but not quite. I'm gonna bend your knees, don't help me. Right short. Cross it over. Any pain in your back there?
Mm-hmm.
Do you have any discomfort when I push here?
Mm-mm.
This one.
Mm-mm.
Here.
Nope.
Tender?
Yes.
This is our primary right here, SI joint. Still crappy up here.
Mm-hmm.
I'm gonna spray your back with this magnesium. Nice, gentle breathing.
Oh, I feel that. Ooh. What is that?
Tension. Here comes more spray.
I feel that one in my ear.
Basically, like, your nerves are just telling your spinal cord and brain that there's all this crazy stuff going on. And we need to clear out that signal, smooth it out.
Wow.
I'm gonna hit this trigger point now. This isn't gonna be completely comfortable. Kind of like relax into it. This side's better, right?
No.
This side too?
Oh, God.
Nice and gentle. We're gonna follow the breath down like this. Gentle, sinking.
Oh, that's been needing that for quite some time now.
You're gonna take a deep breath in, and then at the top is when I push. Shoulders relax as you breathe out. Let it all go. Still tender?
Not nearly as much.
5, 4, 3, 2. Let your shoulders relax all the way in this time now. Following the sacrum down, here's the SI joint right here. It's still got swelling in it, so we definitely have to adjust that. Do you have any tenderness here? Right there, right?
Yeah.
This is actually related to this stuff up here. Still tender?
Not as much, no.
Lift your right leg up in the air. Down. Lift your left leg up in the air. Down. Go ahead and march in place. That right hip wants to come internal. Right even here. It's lower on the left, but right short legs. This does not coincide. Bend the top leg like this. Nice and gentle. I'm going to stretch your shoulders up like that. We're going to bring this down.
Ooh. That was good.
Try to let your head relax as much as you can. Back to center. Now turn your head to the left. Bring your right ear down to your shoulder. Left ear down to your shoulder. Gentle. All you have to do is loosey-goosey. Good. Whoa. That was pretty intense. As you breathe out, let it drop.
Whoa.
Okay, breathing in. Now, sinking in gentle here.
Still alive. My head's attached. I feel good. I did have a lot of hip pain, so this feels, I have more mobility in my hips.
Ooh.
Push, push. Push here, push.
Ooh.
...2018, I was involved in a motorcycle accident. I ended up under her front driver tire. I suffer a lot of lower back pain, both my knees and my lower neck.
Do you have low back pain every day?
Yes.
Does it ever go down your legs?
My left leg goes down and then it numbs.
Do you feel it all the way to your toes?
Mm-hmm.
How often does that happen?
A couple times a week. When I look down, I get a pain that shoots up into my front of my head. It causes a lot of dizziness, headaches.
How often do you have a headache?
Every day.
Some cognitive dysfunction, traumatic brain injury. What else do you got? Dizziness?
Dizziness, definitely brain fog. I have physical therapy, cognitive therapy, dental therapy, and aqua therapy. 4 therapies every day, all day long.
Looking at the feet first, there's some external rotation on the right. You can definitely see the hip restriction here. There's major restriction somewhere in the pelvis. She does have nerve pinching, so it's L4, L5. Both feet are externally rotated. High left hip. There's a lot of strain right here. It is the mid-lumbar spine, so we should be around L3 here. And left shoulder blade. I'm going to do a temperature evaluation using the back of the hands, which are more sensitive to temperature. A lot of heat coming off right here in the lower thoracic on the right. And then it's bilateral up in the shoulders. Definitely warmer up here. You're doing the most amount of work right here at the top of the shoulder blades. That one versus this one.
That one.
That's probably at the SI joints. Tenderness,
Yeah.
lower right, upper right.
The upper.
I'm going to push into your spine a little bit. We're just going to feel the motion of the joint. There could be more motion here, that's for sure. Sliding up to the bottom of the glute fold here, it looks pretty even, but slightly lowered on the right. That means the right hip is rotated back like that. And then looking from the top, the right side comes out, so that's possible external rotation on the right. No rib humping and no major prominence here. Tender.
Just a little bit.
This is interesting, actually. It's very squishy, lots of swelling here. Do you get pain from this area?
More in the bottom, but there is a lot of pain right there.
Left short stays short. Nice, gentle breathing. Let's give it a try. Go and take a deep breath in through your nose. Shoulders relaxing, sinking, and let this all go. And out. Good, sinking in. This one's a little bit different. This time you're going to take a deep breath in, and then as you breathe out, that's when I'm going to push at the top of the breath. Deep breath in. Let your shoulders relax as you breathe out. Lean back as you blow it out. Breathe. Breathe. Breathe, 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 breathe.
I felt it that time.
Okay, so let's give it a try. Go and take a deep breath in and out. The shoulders sink in here. Hold on, there's more. Bottom leg is straight, top leg is bent. I'm going to scoot you forward. Go ahead and take a deep breath in and out. Let the shoulders relax. How's that feel?
Really good.
Turn your head to the right. Back to center. Turn your head to the left. Back to center. Bilateral upper cervical here. Let the head relax, shoulders sinking. And then we're going to push in that direction like that, okay?
Mm-hmm.
Very nice. Let it go. Perfect. Feels okay, but there's more in there. We're going to do the same thing. Let your head drop, shoulders drop. Good. Nice, soft breathing.
That felt good.
Your right side now, same thing. Sinking in. You don't have to help. Let the shoulders go. Good, 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 good. Breathing in through your nose and out.
It feels amazing. Ah, yes.
Oh, no. Okay, I'm going to do a diaphragm manipulation now. So we're going to do some nice, gentle belly breathing. You know how to belly breathe into your belly? Push your belly out. Now breathe in, but push your belly out at the same time. Let this relax. Breathe into your belly. Nope, stop. Now breathe in and push your belly out. Now breathe out and suck your belly in. Only breathe into your belly. Better. You need to practice this. Just like the other adjustments, I'm going to follow your breath, and as you breathe out, we're going to come in this direction like that. And then at the end, we pull, okay? Nice and gentle breathing. Keep your teeth together. We'll follow this breath out. Let your shoulders relax. Let your head and neck relax.
I'm scared to move. That was big. I don't know. I feel like I'm a new person.
When I would walk, something would grind. I don't feel no grinding when I'm walking. Neck feels amazing. My back feels amazing. I can stretch. I feel like a new woman.
Walk down the hall. Wow, much smoother.
Yes.
Your shoulders are much closer to even. Hold on to your elbow. Let this relax here. Good. Go, let that go. Do you have back pain or neck pain?
Yes, neck and lower back.
Which one's worse?
Probably my neck.
How often does your neck hurt?
Maybe a few times a week. Sometimes when I sleep or if I'm working out, it'll bother me.
Sleeping and working out, you feel it in the morning when you wake up. You feel it at the gym or after the gym?
More after the gym or like the day after.
When your neck does hurt, how long does it hurt for?
Maybe a few
But
hours.
your neck cracks frequently.
Yeah. Sometimes I just do it to get that relief.
How long back can you remember this neck pain?
Probably a few years now. Definitely ever since working constantly with my neck down. And I've noticed that's when it starts hurting. I actually get migraines, but I take medication for those. They actually haven't been as bad for the last few years.
Numbness or tingling in your fingertips?
No.
What about the low back? How often does that happen?
I mean, again, I think that's when I'm working. If I'm standing all day.
Did you have any accidents or injuries?
No.
You definitely have some pronation happening on the right. It's pronating bilaterally. It's straight up and down from the knee down. High right shoulder with a high right ear. Hip swing looks even from left to right. I don't see any external or internal rotation. Definitely a decrease in the arch and a pronation on each side. Slight bowing of the Achilles tendon here, which means it is pronating. The left hip is higher with a high right shoulder. It's lower on the left. There is hypertonicity in the right glute right here compared to the left. Close your eyes. Looking for postural swaying here. Looks like mostly forward to back. I don't see any lateral swaying. I'm going to do a very gentle scan on the top of your spine. Very symmetrical tone and temperature all the way up and down your spine. Most of the resistance is right here. The tone of the muscle changes in the thoracic lumbar here. I'm going to dig in a little bit deeper to your spine. Tender?
Mm-hmm.
Not as much up here, right?
Mm.
On the right side, it's tense as well.
Mm-hmm.
But it's not. It's more on the left.
Yeah.
Left or right?
Both.
Both.
Yeah.
Lower SI joint.
Definitely right.
This right here, right?
Yeah.
This
yeah.
joint's swollen right here. There's a little bit of a sway to the left there, so it tells me that your sacrum's off like this. Let's bring your left ear down to your shoulder. Right ear. Which side feels more restricted to you? Left.
Yeah.
Still curves off to the left. Right there, is that tender all of a sudden. You have tension here. This is where your shoulders hurt when you're working.
Yeah.
Traps.
Mm-hmm.
Which one's the most tender? 1, 2, 3, 4, 5, 6, 7.
3 and I think 5.
We need to adjust T6 and L2. L2. Right, left.
Left's a little bit more sensitive.
Right there, right?
Yeah.
We're just going to contact this and hold it gently for a moment. Let your back and your shoulders sink in. Did you feel that spasm there?
Mm-hmm.
It's releasing down here. Feels better, right?
Mm-hmm. It is crazy. Wow.
Left, down, right, down.
Wow.
Let the shoulders sink in.
Oh, God.
Shoulders sinking in. Still tender?
Not as
I'm
bad.
gonna bend this top leg like this, bottom leg stays straight. My hips forward here like this a little bit. Nice and gentle breathing. As you breathe out, I'm gonna support your shoulders and push in that direction like that. I'm gonna bring the hip down like this. This one's forward like this. It needs to go back down. How's that?
Good.
This side is going back like this, so we're gonna bring it forward. Breathing in and out.
That one felt good.
Turn your head to the right. Turn your head to the left. Back to center. Bring your right ear down to your shoulder.
Like my whole head?
Yep, back to center. Left ear. Nice and gentle breathing. I'm just going to bring your head over to the side right here. I'm just going to gently push in that direction.
Feels good.
We're going to bring this guy over to the side like this, gently moving in this direction.
Feels crazy.
I'm going to crack your toes now, okay?
Oh God.
Talk to me. What happened?
I don't like it.
don't
Oh,
like
my
it.
ex-boyfriend. I don't.
It's only emotional, okay?
Okay.
And there's more trauma with that relationship stored in your toes here than you think.
Oh. Oh, I've never had that done before.
Breathing in through your nose. To your belly. Next is the pyloric sphincter. This is 2 inches above the belly button. Deep belly breath right here. Shoulders and hips, everything's letting go. We're gonna follow this breath out.
This pulling stuff freaks me out. Feels more even. A lot of tension released. Oh my God.
You got that, relax.
Some like neck and shoulder pain, and sometimes like lower back pain.
Which one hurts more?
The neck.
How often do you have the neck pain? Like every day, a couple times a week, a couple times a
Yeah.
month? So high school you had neck pain? Before high school?
Mm-mm. I do a lot of computer work.
Okay. Do you get headaches?
Probably almost every day.
For how long can you remember having headaches every day?
For about like 2 years.
Anything changed 2 years ago?
New job.
You wake up in the morning and have either neck or low back pain?
Neck pain for sure.
Do you take any other pharmaceutical medication?
Yes. Escalopram. Almost 2 years.
Has anyone looked at your neck pain before? Has anyone tried to help you with it?
No. This is like the first time I've ever been to a chiropractor.
Looking at the feet first, we're definitely pronated on the right and possibly left too. I don't see any genuvarum or valgum. Looks like a high left shoulder, but also high left hip. Okay, looking at the hip swing, we're definitely diving off to the left. Definitely decreased. There's no arch here at all. Pronating on the left, not as much on the right. Definitely a high left hip. You just lean a little bit off to the right, and then your head goes like this. The musculature is a little bit more prominent on the right. All right, I'm going to do a very gentle scan at the top of your spine. I'm going to do a temperature scan now. The back of the fingers are more temperature sensitive. All the heat is right here at the bottom of the scapula, and it cools off and then increases right here. I don't suspect that you have any pinched nerves or herniated discs. I'm going to palpate the SI joints here. Tender?
A little bit.
Any tenderness here?
Mm-hmm.
Okay, right side, any tenderness here?
Mm-hmm.
Okay, where is it more? Lower right or lower left?
Lower left.
I'm going to dig in a little bit deeper into the muscles. Your muscles are more prominent on this right side. Just a little bit on this right scapula. Right there. A little tender on that guy.
Mm-hmm.
Lean to the right. Which one feels more restricted to you? Left?
The left.
I'm going to look at your glutes now. This helps determine which way the pelvis is rotated, okay? Lower on the right, that means your right glute comes down like this. That means your right hip is going backwards. Looking from the top, the right side is more out like this, so the right glute comes out. Right short crosses over. Any pain, discomfort, tension here?
Mm-mm.
Here.
Mm-hmm.
Tenderness, discomfort here?
Mm-hmm.
Left, right.
The right.
Left or right?
Right.
Transverse process tender on the left. That means this is a PL. This L5 is going to the left. And then spinous process tender on the right, which means it's gone superior. This one is twisted like this and then turned like this. And it's actually turned in the same way that the pelvis is coming down like this. We're going to bring the pelvis back up like this. And then we're going to untwist this one like that. Tender.
Mm-hmm.
Nice gentle breathing. So you're going to take a deep breath in, and I'm going to follow your breath like this with my hands as you breathe out. Okay, let's give it a try. Following it down. Another deep breath in, sinking in. This time you're going to take a deep breath in, and then at the top of the breath, that's when we push, okay?
Okay.
Good, and then let it all sink as you breathe out.
Oh, great.
We're going to bend the top leg like this. Let's get you forward here like this. I'm going to push it up with my hand. Then I'm going to use my hip to push against your thigh. Nice and gentle breathing. Nice and gentle. Take a deep breath in and out. Shoulders. Did you feel how it cracked right underneath my hand? Like it was exactly what needed to happen. Head to the right. Center. Left. Center. Bring your right ear down to your shoulder. Center, left, gentle breathing. As you breathe out, I'm going to follow your breath and we're going to push like that, okay?
Mm-hmm.
All right, let's give it a try. You're going to take a nice soft breath in and then let your shoulders relax.
Oh my God.
Nice and gentle, just like the other adjustments. We're breathing. Good, we're going to come right up into here.
Ooh.
The ileocecal valve. This is where the large intestine and small intestine meet. We find this by first finding the belly button. Yours is here. ASIS, yours is here. Connect these two dots. Yours is right here. It's probably a little tender. It's also active right now. You okay with that?
Yeah.
We're going to go like this. And as you breathe out, we're going to follow your breath. And then when we get to the end of your breath, we pull like that. Keep your teeth together. Breathe out. Let it all sink in.
Oh my God.
Maybe a little too. I think you can do one more.
Oh.
That was the one.
My body feels good. I feel like I have like no neck pain. Like my back feels straighter than it was before.
Push, push. Right side, push. As hard as you can. Lean forward again, just a little bit. Good. Keep going. Keep going.
Definitely notice a lot when I'm driving, like anything over half an hour, it's just so stiff. I always think like I'll try yoga and it will help me, but then I feel like I come away feeling a little bit worse. I work on my computer a lot, so I always have that kind of neck thing.
How long have you been noticing that that's been going on for?
Maybe like a year.
Is it once a week?
It's like repeated a couple times a day.
So cumulative.
Mhm.
Do you get headaches ever?
Yeah, definitely. Once every 2 weeks.
What's the trigger?
Alcohol. Yeah, like not sleeping enough.
Where on your head does it hurt?
Probably like here. Also, actually though, my hip pops a lot. Like, you know, if you like do an ab workout and like you put your leg down, mine always pops.
That's somewhat common, and you can work that out. Usually that does show that there's some kind of imbalance, but sometimes just getting adjusted works that out.
I'm nervous but excited.
Looking at the feet first, just a little bit of rotation externally on the left, slightly more than the right. That's quick. So even when you slow down a little bit, now the left foot is straightened out. That's interesting. It looks like a high left shoulder just from the initial hip swing from left to right. It's very straightforward. There's not a whole lot of movement. Arches are intact. They're symmetrical. It looks like a high left hip, high left shoulder, and a high right ear. I'm going to do a very gentle scan on the top of your spine. A little bit more prominent on the left side. Are you right-handed?
Oh, yeah.
I'm going to do a temperature evaluation with the back of my fingers. Back of the fingers are more sensitive to temperature changes. Very symmetrical, but then when we get to the top of the spine here, your shoulder muscles are working much harder than the rest of your spine. Good moisture content of the skin, no dryness. Tender?
A little bit.
Here.
Yeah.
Okay, I'm going to palpate the SI joints. Any tenderness here?
A little bit.
S4. Any tenderness here? Left, right. More tender on the left, right?
Mm-hmm.
Good motion in the lower part of the spine. A little sticky there at L3. Go ahead and bring your chin to your chest. Bring your left ear down to your shoulder. Muscle check. A little bit of tension here. Which is worse, right or left?
Right.
You're going to feel my fingertips on the back of your hamstrings. It's very close to symmetrical, but lower on the right. And then looking from the top, the left glute comes out further. The right hip has gone back and in, where the left one has gone forward and out. No rib humping, no deviations to the left or right. And the upper thoracic spine does flatten out right at that T1, 2, 3 area. No forward and back though. It really is mostly left to right. Okay, I'm going to push down into your spine just a little bit deeper. Tender or ticklish?
Tender.
Right side?
Mm-hmm.
Got some work to do here. T1 and T3 down here too. Left short, that matches the high left hip, but that contradicts what we saw with the glute test. Left short stays sharp, which means the right side is the primary. I'm going to push back into the left SI joint. We're still tender here. Right versus left.
Right.
That tells us that there's more of a joint issue. Left or right here?
Left.
Gentle breathing. We're going to work on the trap fibers here at the bottom of the skull. let's practice one first just so you can kind of feel what it's like. Take a deep breath in and out. At the end of your breath, we just go a little bit farther and sinking in. A deep breath in all the way as far as you can go. Good. Shoulders and hips, let it all go. Okay, nice and gentle. Deep breath in through your nose and out. Shoulders coming up. There's more. Hold on. Gentle breathing. Let the hips relax and shoulders relax.
Very nice.
Back to center. Left. Right upper cervical. Okay, bring your right ear down to your shoulder. Center. Left ear. Nice and gentle breathing. Let your head and neck relax as much as possible. There you go. Gentle, 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 gentle. Let your head and shoulders drop into the table. One more. Very top. Your neck does not want to go that way. We're going to correct the rotation from the left side. Nice, gentle. Let your head drop down.
That felt deep.
This is the one that got stepped on.
Mm-hmm.
I'm going to adjust the ankles now. Very gentle pull in this direction like this. Nice and gentle. Hold. This is where we begin looking for the ileocecal valve. Okay, let's do this. Bring your hand up here. Put your hand on top of my hand. This decreases the ticklishness. Okay, deep belly breath. 2 more belly breaths like that. This is the pyloric sphincter. It's 2 inches above the belly button. Yours is very tight. Tender or ticklish?
Tender.
Do you get reflux?
A little, yeah.
More belly. Push your belly all the way out. Yes, that's a belly breath. Okay, so this is a full spine adjustment. Nice and gentle. This helps me support your neck. All you're going to do is breathe. As you breathe out, we follow the breath like this. And then at the end, we give it a pull in that direction, okay?
Mm-hmm.
This is not going to hurt. Okay, It's not dangerous at all. You're fine.
Got it.
Did you feel it all the way down?
Yeah. I don't think I make a lot of sound. I don't know what could be the reason.
It's your constitution. It's how your joints are set up.
Yeah. Feel a little lighter. Ooh.
Good job. Let that relax. Push hard as you can. Keep going. Right side. Push. Go.
I always get occasional back pain. I also get occasional neck pain that causes migraines. I think it's like muscular. I get lower back pain a lot, especially if I sit on the floor and I'll go to get up. I notice that my tailbone, it literally feels like something is stabbing me. And then my hips. I know I'm uneven. When I stand up, I can feel one hip is higher than the other.
How far back can you remember having migraines and headaches?
9, 10 years old.
Do you get sensitivity to light?
Yes, like crazy. I had a migraine the other day. I threw up everywhere. If I closed my eyes, it helped because the light sensitivity, but then I still felt that muscular pain hurting me like almost back here.
What about the low back pain?
Let's say I'm like squatting to pick something up. I'll feel it all from down here up to like right above where my hip is. If I'm getting up from the floor, I need to do it slowly. If I don't go slow, I'll feel like almost like a tear.
Looking at the feet first, looks symmetrical. Now there might be some slight pronation on the left foot. Looking at the hip height, it looks slightly higher on the right. Looking at the shoulder height, we have a high left shoulder, a high right mastoid process, high right ear. No genuvarum. It looks straight from the knee down. Arm sway looks symmetrical. We do have a decreased arch on the right compared to the left. Let's see if it pronates. We do have some slight bowing on both sides, slightly more prominent on the right. There's a lot of increased tone here. Does one side of your neck hurt more than the other?
Yeah, I can feel like more tension on this
I'm gonna
side.
do a temperature evaluation with the back of my hands, which are more sensitive to temperature. All the heat is right here at the top of the shoulder blades. Definitely a decrease in heat as we get lower. Some muscular prominence here in the left lumbar. I'm gonna palpate your SI joints now. Any tenderness here?
Not really.
There's definitely some swelling here.
Yeah, it feels weird.
Bring your chin down to your chest. Back up. C6 on the left. Now bring your left ear down to your shoulder. Right ear. Left lateral flexion restriction. And which is more tender to you? Is it the left side here or the right side here?
The left side.
We're going to slide up to the bottom of the glute fold here. It's lower on the right. That means this right hip is going back like this. Looking from the top, they're pretty much even. Looking for curvatures of the spine here. We definitely have some prominence on the left. We're just looking for small movements, swaying movements. There's some off to the left. Here goes forward right, now back. Good compensations. You can crack your back.
Mm-hmm.
You crack it every day.
Yeah.
Which one do you feel more? This one on the right or left?
The right.
Left more than right?
Yeah, for sure. That hurts really bad.
Right short crosses over. Left. Down. Which side was more difficult?
This one, and when I get to like here, I feel pain here.
Nice gentle breathing. Let's start with this guy right here. Gentle, gentle, gentle.
Holy.
You start to breathe out. That's when I'll push.
That was crazy.
Bottom leg is straight. We're going to bend the top leg like this. Deep breath in. Good and out. Sinking in, shoulders and hips relaxing.
Oh my god.
Does it feel like that when you crack it?
No. I can never crack down there. That felt amazing.
Turn your head to the right. Back to center. Now turn your head to the left. Nice and gentle breathing. Nice and gentle breathing. Shoulders relax and hips relax. Let the head drop in.
Holy that was crazy. Oh my god.
Gentle, gentle, gentle. Shoulders sinking in.
Amazing. Be careful, actually, the big toe. It's got ran over.
Nice and gentle little pull.
Oh my god. Oh my god.
Let it relax here. You're gonna squeeze my fist in between your knees, okay?
Okay.
Squeeze as hard as you can.
Oh my god.
Was it in the middle?
I think that it was like here.
Push your knees out to the side. Push, hard as you can. Hard as you can. Keep pushing. Squeeze.
Yeah, it was down here.
So we start with the ileocecal valve. This is the valve in between the large and the small intestine. We locate it first by finding the belly button. Yours is right here. And then the ASIS, the front of your hip, is there. Connecting these 2 points somewhere in the middle is where we begin looking for the ileocecal valve. Yours is here. Okay, so we're going to go to the pyloric sphincter next. This is 2 inches above the belly button. Do you know how to belly breathe? Perfect. I'm gonna use this towel to support your neck. You okay with me doing that?
Okay.
Nice and gentle breathing. Just like the other adjustments, I'm following your breath. As you breathe out, we're gonna come in this direction like that. Deep breath in and out.
Oh my god. I kind of hated that. Feels like an out of body experience. That's crazy. I could feel that through my whole body. There's bones in there? It just feels like so much tension is relieved. I couldn't even like move my neck like this without feeling tight pressure back here.